Chronic venous insufficiency is a medical condition characterized by impaired blood flow in the veins of the legs, leading to various symptoms and potential complications. Veins are responsible for returning blood from the body's tissues back to the heart, and they have one-way valves that prevent blood from flowing backward. However, when these valves become weakened or damaged, blood can pool in the lower extremities, resulting in chronic venous insufficiency. One of the primary causes of chronic venous insufficiency is the dysfunction of these valves, which can occur due to a variety of factors. Activities that involve extended periods of standing or sitting can place increased pressure on the veins in the legs, leading to valve damage over time. Excess weight can place additional strain on the veins, contributing to valve dysfunction and impaired blood flow. Hormonal changes and increased blood volume during pregnancy can affect the function of the venous valves, leading to chronic venous insufficiency in some women. As people age, the elasticity of the veins can decrease, making the valves more susceptible to damage and increasing the risk of chronic venous insufficiency. A history of blood clots in the deep veins of the legs can cause damage to the valves, resulting in chronic venous insufficiency. The hallmark symptoms of chronic venous insufficiency include swelling, pain, heaviness, and fatigue in the legs, particularly after prolonged periods of standing or sitting. Other common signs may include the development of varicose veins, skin changes such as discoloration or thickening, and in severe cases, the formation of leg ulcers, especially around the ankles. Diagnosis of chronic venous insufficiency typically involves a physical examination, medical history review, and possibly imaging tests such as ultrasound to evaluate blood flow in the affected veins. Treatment aims to alleviate symptoms, improve blood circulation, and prevent complications. This may involve lifestyle modifications such as regular exercise, elevation of the legs, and wearing compression stockings to support vein function. Medications, such as vein toning agents or anti-inflammatory drugs, may be prescribed to manage symptoms. In cases where conservative measures are insufficient, medical procedures may be recommended. These may include minimally invasive techniques like sclerotherapy or endovenous ablation to seal off malfunctioning veins or surgical interventions to repair or bypass damaged veins. Early detection and management of chronic venous insufficiency are crucial to prevent complications such as skin ulcers or venous thromboembolism and to improve the overall quality of life for individuals affected by this condition. Therefore, individuals experiencing symptoms suggestive of chronic venous insufficiency should seek prompt medical evaluation and treatment. Vascular surgeons play a key role in the diagnosis, management, and treatment of chronic venous insufficiency. They have expertise in evaluating the vascular system, particularly the veins, and can offer various interventions to help alleviate symptoms and improve blood flow in patients with vascular surgeons play a key role in the diagnosis, management, and treatment of chronic venous insufficiency. They have expertise in evaluating the vascular system and can offer various interventions to help alleviate symptoms and improve blood flow in patients with chronic venous insufficiency. Vascular surgeons are skilled in diagnosing chronic venous insufficiency through a thorough evaluation, including a physical examination and possibly imaging tests such as duplex ultrasound. This enables them to assess the extent of venous insufficiency and identify any underlying causes or contributing factors. Vascular surgeons may initially recommend conservative measures to manage chronic venous insufficiency symptoms. These can include lifestyle modifications such as regular exercise, elevation of the legs, weight management, and the use of compression stockings to promote venous blood flow and reduce swelling. Vascular surgeons are proficient in performing minimally invasive procedures to treat chronic venous insufficiency. These techniques aim to close off or remove malfunctioning veins, redirecting blood flow to healthier veins. Common minimally invasive procedures include sclerotherapy, which is when an injection of a sclerosing agent into affected veins to cause them to collapse and eventually be reabsorbed by the body. Another minimally invasive procedure is endovenous ablation, which is the use of heat or chemical agents to seal off abnormal veins, rerouting blood flow to healthier vein. Ambulatory phlebectomy can also be done, which is the surgical removal of varicose veins through tiny incisions, typically performed on an outpatient basis under local anesthesia. In cases where minimally invasive procedures are not suitable or effective, vascular surgeons may recommend surgical interventions to treat chronic venous insufficiency. Surgical options may include vein ligation, which is the surgical removal of the diseased vein through small incisions, followed by ligation of associated branch veins. Another surgical option is in bypass, which is the surgical creation of a bypass around the blocked or damaged vein to restore proper blood flow. Vascular surgeons provide comprehensive post-treatment care, including monitoring the patient's recovery, managing any complications that may arise, and offering guidance on long-term management strategies to prevent recurrence of chronic venous insufficiency. Vascular surgeons play a crucial role in the multidisciplinary approach to managing chronic venous insufficiency, offering a range of interventions tailored to each patient's specific needs and circumstances. Their expertise helps improve symptoms, enhance quality of life, and reduce the risk of complications associated with chronic venous insufficiency. Give our office a call today at 480-668-5000.